Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
My name's Hazel Dockery from Practice Plan, and welcome to Podcast. With me today is Lisa Bainham, who, if in case there is somebody somewhere who's never heard of her, I'm going to ask her to introduce herself in a minute. But we're going to be talking about mastering challenging conversations. So thank you for joining me, Lisa. It's great to have you here.
Hi, Hazel. Yes, it's another aspect of practice management joy. There's lots of topics, as you know, but yeah, love doing the podcast because I know how valuable and relatable this can be for people out there.
Now, you're very well known to a lot of people in the dental industry, but there may be a few people who've never heard of you. So do you just want to introduce yourself and give us a little bit of background, please?
So my name is Lisa Bainham. I've been a practice manager for nearly 30 years now. Love practice management, really enjoy it. Love supporting other practice managers. I'm been involved with ADAM, the Association of Dental Administrators and Managers, for many years now, and still in the background as chair. I've also got my own consultancy, which is Practice Management Matters. I visit lots of dental practices around the UK and offer support from front of house training through to the other end of business development, helping practices grow, and just cover all sorts of marketing, HR, a little bit of everything, whatever people need me to be. It's kind of like the Mary Poppins effect in many places. But we've also, I've managed a couple of practices in Crewe. We opened in '98 and have built it to a 2-site team of 42 referral practice. Got involved with Practice Plan back in 2003. So lots of experience. I keep saying I'm going to write a book one day, but new things keep popping up and happening. So I love working in dentistry, and I absolutely love being hands-on with different teams and helping them, supporting them, and just guiding them. You know, we just mentioned briefly before we come on the recording, that, you know, quite often experience means that we've experienced something and done something badly or not ideal, and if we can give other people the benefit of our experience and mistakes and they don't make the same ones, then that's a really great thing.
Indeed, yeah. But I mean, we always all need to remember that you never learn anything by getting everything right all the time. So it's the negative or the bad experiences, what we do wrong, that teach us things. So it's fair to say, been there, done that. T-shirts now a duster when it comes to working in practice.
Yeah.
So mastering challenging conversations is the title of the podcast. What sort of challenging conversations are we likely to come across in a practice, do you think?
So for me, I like to look at things from a very simple point of view. I like to look at our patient journey. I think people find it relatable. What's happening when people are making contact right the way through to the end of treatment, and looking at what the challenges could be all along that journey. You know, and quite often it starts at reception, starts with front of house team, and it can be pretty much, you know, sometimes feel like the front line. And you know, certainly in some practices where they will pop a nurse, you know, it's holiday season coming up, they'll pop a nurse on reception and expect them just to, you know, to be amazing. And it's not just about the processing and the management of the processing patients in and out and all the rest in between. One of the most scary bits is the challenges that you get on reception. You get, you know, quite difficult people, sometimes difficult conversations, and you have to feel that, you know, or you at least need to know how to take it and then where you go with it. And I think that's having the confidence. and I did call it, mastering challenging conversations, but it's almost like engaging your superpowers, and we'll come on to it in a little bit about what those superpowers, in my opinion, are. But the difference I've seen with teams go from feeling like they're at the mercy of difficult conversations, and when they start to get some of these little tools, these superpower tools in their toolbox, the difference is unbelievable. And I love that, you get these confident, and it's the same as anything, you do something enough times and your confidence will grow, your assertiveness will grow. And so many people spend a lot of time training the team on how to do technical things or clinical things, but this is a personal skill. And this is something that needs to be nurtured, needs to be grown, but you also do need those little superpowers that you can whip out and defend yourself and manage the patients. And this isn't about getting your own way, winning conversations, or making sure a patient's complaint goes away. This is about just communication and making the patient happy and hopefully getting a good result for yourself, and not feeling like you're anxious and you've got them palpitations, or you go home and you're worrying about it. And it's a job at the end of the day,
but I always think that reception is one of the toughest jobs in the practice.
It's not a bum on a seat. It's not a let's get one of the nurses, bless them, who are quite happy to fill in, but it's not fair. It isn't just a bum on a seat anymore. It's you've got to be so well equipped emotionally and experience wise and confident. You've got to have those, be equipped with those skills, otherwise you will absorb it, or things will go wrong and the patients will be triggered. Having these conversations, if people think that you're not very confident, things can take a bit of a turn sometimes. So
people smell weakness, don't they?
They do. Yeah, we all do, don't we, in a way? So the conversations that can happen on reception, things like a patient turns up late and shouts at you. They've turned up late, or a patient's come on the wrong day and it was your fault. It can be anything. I kind of start off these sessions with, have you ever? And it's have you ever had a patient shout at you because the weather's bad? Have you ever had a patient blame you for the cost of the treatment plan that the dentist has given them? Do you ever look at your day list and literally want to run out the back door when you see a certain person's name? And my thing is, why do we do this? Why are we allowing people to sort of hold us hostage and intimidate us in a way? And I'm not saying that they come in and that's their intention, but it is intimidating nonetheless sometimes. Challenges happen. A patient might be, you've missed X number of appointments, we are now going to make a charge. And most of the time, these are things that the practice has decided, and it's not, Josie on reception that's just got up and gone, do you know what, I'm going to make this patient upset. These are practice policies that we need to all stand by. So my question to practices is, if you've got a patient that is quite often torturing you nearly every time they're coming in, why are we still seeing them? So my team are more important than that one patient. So if a patient is being unreasonable, and don't get me wrong, we're bearing in mind sometimes the patients are anxious, sometimes they're feeling stressed because they've been trying to run out the house and get across town in time to make, there's external factors, because most of us at front of house are, we're pretty tough. We're not delicate flowers that, go to pieces if anybody sort of questions us or anything. But why are we allowing these patients into our practice? Now, the beauty of obviously being private practice is that you don't have to, put up with things in the same way that we do have to with an NHS patient more often. But the question is, if this patient is unhappy every time they come in, are we the right practice for them? So going through conversations with the team, one about why are we allowing this person to come in. If a patient is rude or disrespectful to a member of the team, then that needs to be addressed. And quite often I do believe that needs to be addressed probably by the dentist when they go into the surgery, because they never, well, very rarely air that to them. And the conversations are, you know, reception will say at lunchtime, Mrs. Such and Such was really awful to me. I actually got really upset. Oh, she was fine when she came into surgery. And it's like, oh, that's okay then. It's passive. And I've said how it makes that you feel as part of the team. Someone shouted at you and you think it's okay that they shouted at me. Is basically what we want to say. And it's like, no, we have to stop this behaviour being acceptable, being the normal. So preparing our team to say, hang on a minute, you know, Mrs. Jones, I'm just going to stop you there. I can see that you're upset. I am going to sort this out for you. However, it is not going to happen right at this moment. Please may I ask you to go home, and I will ensure that somebody calls you before the end of the day. And that sort of empowerment, we're not being rude. We're showing that we've listened. We're showing empathy and recognition, but we're also in control of it. So it's these sort of conversations and statements to patients that can make a team, you know, particularly a front of house team member, feel brave and feel happy to do that. You know, we're going to stop you there for a moment because you're raging at me. And quite frankly, not anyone rage at me. So yeah, just relating, you know, there's got these things happen in every single practice that I've ever been to. And what happens sometimes is we try to empathize, and we try to make excuses for whatever's happened, and sometimes there's no excuses, and we just have to recognize things that can trigger patients or things that can actually calm these sort of conversations. When I was talking before about engaging our superpowers, for me the superpower is emotional intelligence. It's EI. It's so powerful in a healthcare setting, because what you're looking at is you're looking at self-awareness, understanding when we individually are triggered, and knowing when we need to sometimes take a step back from it. So, you know, for example, a patient questions your diagnosis for the third time and name drops Google.
Which always goes down well, doesn't it?
You know, and what patients are doing these days is actually coming in with their own ChatGPT treatment plans. Which it's great. Do you know, it's not, some of them aren't bad.
But that's not the point.
It's not the point. So what we need to do, you know, this isn't about ego. This is, how dare you question my treatment plan? You know, this needs to be, okay, you know, let's have a look through this together so we can look at a plan that is going to be the most sensible and best way forward for you. What we're saying is, okay, well, I'll humour you. You know, and it's just taking that step back instead of, you know, quite often with more clinical people than admin people, you know, things such as, you know, patients not been in for a few years, and now they're like crying on your own reception and begging for an appointment. And, you know, quite often a clinical person has more of the IQ than the EQ, and their reaction will be, well, if you come in the last couple of years, and you won't be in this mess now, would you?
Yeah, quite.
You know, the patient knows this. They know they've not been in. What actually we need to do as healthcare people is say, I can see how much this is uncomfortable for you. Let's get you sorted, and then we can have a chat going forward. You know, just take control of it. Don't be triggered by things. You know, we shouldn't take it personal. So one of the other,
to me, what you're saying is, we need to take some of the emotion and some of the heat out of the situation. Is that fair?
Yeah. So us adding emotion is just going to make it even worse.
Yeah.
So yeah, one of the other superpowers that I try to give to the teams is self-regulation. Pause. Think about what you're going to say. And quite often, if it's a challenge or it's a complaint, that kind of thing, we don't have to jump in. If we're not prepared and we haven't got all the facts, we've got any doubts about what's actually happened, kick it down the road a bit. You know, it's really important I get this right for you. I want to be able to look at this properly for you. So all I'm going to ask you is you to give me perhaps a couple of days so that I can speak to the relevant people. And then I will come back to you and we'll find a resolution for you, or an agreeable solution. You know, that these kind of words are positive words, they're empathetic words, but we're also self-regulating. We're not jumping in there and getting defensive and then just making it all worse. Now, empathy, another superpower for me. Empathy and rapport are probably two of your most powerful things with communication skills.
Yeah.
Empathy for any situation. And again, it's not always prevalent with very clinical people. Like
we are making a generalization there, but yeah,
definitely, because you know, and it works because, you know, clinical people have to make clinical decisions. They
indeed
do need to take emotion out of things, but we have to sometimes, you know, put ourselves in that patient. We don't know the whole story. Sometimes we don't know, you know, we can see this patient's upset, and unless they're a complete lunatic, you know, hopefully we can find a solution for them. So being empathetic to anyone in any situation is a good thing, you know, and building that rapport. Because if we say, Hazel, I completely understand how frustrating this must be for you. I am going to look at how we can make this better. You know, we empathise, but we don't carry it. You know, I was in a practice a few weeks ago and there was a lady at the desk and she was quite upset about the cost of her treatment plan. It'd been quite a shock to her. And, you know, the receptionist was being lovely. And she was like, I don't know how I'm going to afford this. It's just so expensive. And the receptionist said, oh, I know. Oh, bless her. So she was empathising, but she was in it with her. Instead of saying, look, let's go through this step by step. Let's look at some affordable solutions and payment plans. Let's go through it together and see where we're at. We're not over-promising, but we are empathising. So, and sometimes we can be a bit guilty of being over-empathising, you know, showing too much empathy. You know, if a patient, we're not going to see a patient, you know, we feel that we've had too many appointments missed. As a practice, we have a policy. It's not something we like to do, but we do follow the policy, because if we didn't, then what we'd find is that we're having to constantly put fees up to cover the costs, etc. So we feel it's in your best interest to find a different practice that can, you know, manage your expectations better. You know, you're sympathising, but you're not being soft. Empathy and rapport isn't soft. It's not about being weak. It's about finding the way forward. For me, and this is what teams really sort of need to understand. It's very tempting to absorb the stress and feel guilty. You know, what am I going to do? And we're there kind of going, what are we going to do? And, you know, we have got to sort of take a step back from that a little bit. You know, and it's also social skills and rapport. You know, again, there are superpowers, and it's so important that front of house know how to do that. And I always say, you've probably heard me say it before, for any situation, we all want to feel listened to. We all want to know how it's going to be sorted out. You know, so reflection. Hazel, I can see you're not happy. It makes me feel really sad that you've not had a positive experience. What you've said to me is that you felt like the dentist was talking to you in a very patronising way. I can understand why that's upset you. What I'm going to do is I'm going to speak to the team involved, and I'm going to come back to you within the next couple of days so we can have a chat and see how we can make this better for you and how we move forward. How does that sound? You know, and it's resolution, it's reflection, resolution. And you know, you can't really argue with that. you know, so sometimes teams look at me like, you want me to do what? It's bad enough talking to someone when they're not happy, and you want me to engage my 3 R's. I just say to them, when you have these conversations, when it'll become like answering the phone and saying, good morning, you know, X, Y, and Z practice. This is Lisa speaking. How can I help you today? It will become that common, you know, but keep practicing. And there was a practice I was at last week, and one of the first things he said was, do not make us do role play. And I said, honestly, and when we were reading out some situations and how we can react to them positively, they started doing role play. They started actually doing it. And I'm like, it was really
unprompted. Yeah.
Yeah. And it's like, we didn't want to do role play. So yeah, it's giving them some phrases, you know, for being prepared for these challenges, and realizing that it's not personal. Have a little, you know, people say, if you could have a superpower, what would it be? And some people, you know, it's invisibility. Some people it's, I don't know, superpowers, see through walls or whatever it might be.
Yeah, force field.
Hazel?
I think it would be a force field around me, so nobody could get at me. Yeah.
Yeah, well, that's exactly what we need, sort of front of house sometimes. And having that sort of force field, it's like, you know, we can work through this. We will get to the bottom of it, but we take it step by step. And as we start to develop the superpowers, we learn, you know, I can see you're upset. I am going to get somebody to give you a call. Just let me know the best number and we'll give you a ring this afternoon. Take control of it. You know, don't just crumble and, you know, it's, oh my God, this person wants to make a complaint, they're not happy, call the manager. You know, days of I want to speak to the manager shouldn't really be happening in practices anymore, because it is too confrontational, and we can't have a chat and look and manage it properly if we don't know exactly what's doing. And most of the time, us practice managers on the desk, hopefully shouldn't be on the desk. So getting called out to manage a situation in front of a waiting room full of people, it's like, just don't. Let's take control. Let's do it in our own time. Let's do it in our own comfort. Let's do it without an audience. You know,
like you say, that's taking back control of the situation, isn't it? And not reacting sort of instinctively to things and panicking.
Well, yeah, I mean, one of the things I will always say is we respond, we don't react.
Yeah.
And responding, you know, sometimes means we are going to look into this for you. And I can't emphasize enough the empathy and the rapport and the, you know, making it more human, making sure. One of the things, you know, that really drives me up the wall when we're trying to manage complaints, and there is a formal side to these things that we have to recognise, and the legalities and the GDC initiatives that we have to follow and such like. But we can still give that human, you know, if I made a complaint to somebody, an insurance company, I'd expect, you know, Mrs. Bainham, thank you for your email. Here at Eon, we take complaints very seriously, and the platitudes, and you go, oh,
yeah,
they're never going to do anything. Well, I think as a practice, I think we should be given a bit more, and I think we've got the opportunity to actually say, Hazel, I'm so sad that I've heard you didn't have a good experience. Really upsets me. You know that that's not what we set out to achieve, you know, from looking after patients. We're going to sort this out for you. We're going to find a way forward. And just actually being genuine and, you know, calling those patients, or if, you know, front of house have taken an email or taken some notes from a patient that's not happy, doing it in person is so different. But just recognising someone's not happy is an instant diffuser, you know, and finding that way. I made a joke at the show in Birmingham the other day, you know, how many people have worked with some really terrible dentists who have never had a complaint, even though everybody knows they're terrible. And everybody nearly put their hands up and started laughing. And I said, well, those people probably have very good empathy and rapport building skills, because if you've got those things, people are very unlikely to make a complaint or raise an issue against you. I'm not saying that's right, but that's the way it is. If we can get people on side, if they like us, we are much more likely to get a positive resolution from these things. You know, I always say empathy is a strategy, not a weakness. You don't think that you're, oh, well, I'm having to creep around this patient. No, we're building rapport. We're trying to find something. So we've got a good basis to actually get past this problem. It protects your own well-being, but it also helps prevent complaints as well. So yeah, for me, it's get your team talking about what they're comfortable with, what are their little superpowers, how they can engage them, and just get that confidence. I had another request actually from Practice Plan to go down and do some training in September for a practice, and I've said, okay, what is it they really want? They went, they actually just want to feel more confident. I'm like,
Oh,
this is
bless
great.
them.
I know, but it's pretty intimidating. It is pretty intimidating.
Yeah.
You know, there's enough work to do without feeling like you're going to pieces. And even when people aren't being particularly difficult, feeling confident with what we're doing is, you know, and I would say this is a whole team thing, in all honesty, because the team has to be backed up. You know, nobody in any job is paid well enough to feel intimidated or anxious. And you know, it helps with things like staff retention, you know, things like that. People, you know, you're not going to go on, sit on a reception and get battered verbally every single day. No one's paid enough for that. No one's paid enough for that. You know, and having this confidence, it's not only in work, but you do feel better as you start to feel a bit more in control of your emotions, and nurturing those superpowers is lovely to see. When I go back to a practice after a few months, and I'm like, you can kind of see it's like they're not a victim on reception anymore, they're actually in control. And it is just absolutely brilliant. It's a, like I say, superpower.
And you know, you get job satisfaction out of it because it makes you better equipped and more adept at your job. So you'll get more job satisfaction out of it as well, won't you?
Totally, yeah. It's being prepared. These conversations are happening all the time. They'll always happen. And it's being prepared, being able to do it, present, you know, positivity to that patient. You know, we're going to cock up, we all cock up, mistakes will happen, and you know, how we carry them, you know, we recognize that we've not done well there, we recognize that that wasn't an ideal outcome for you, we are really genuinely sorry, what can we do to make this better?
Yeah, because it's about preserving the relationship, isn't it? And
Of course it is, you know, and if somebody wants to carry on and, you know, take that further, then obviously the relationship will end. But our first default will be, how can we sort this out? How can we do this? But making sure that, you know, those people on reception are vulnerable, people that don't feel confident, you know, chucking them on the front line and going, there you go, and expecting them to be happy and patients to be happy, it's just, it's not the best plan to go with, in my opinion.
So to sum up, I suppose you need to be prepared to be able to feel confident, and when you're confident, you're going to be much better able to handle this type of conversation.
Completely. You know, and I'm not a massive fan of scripts, and don't like, you know, I love the fact that teams develop their own conversational skills, and they have their own, you know, depending on where we are, people have got different ways of saying things. You know, in my team, you know, one important thing for us is, instead of, you know, when we answer the phone and instead of going, is it an NHS patient, is it a private patient, it's a patient. Take that away, take it away completely, and actually treat them like a normal patient, not how are they going to pay. And it shouldn't be at the forefront. It should be, what is their dental need at this point? We can talk about money and private and NHS a bit further down the line. You know, how can I help you? What are your concerns? Those sort of things are, again, the rapport, the instant rapport, being honest and transparent, you know, with our NHS patients. You know, some practices are doing instant, you know, no, we're private, you know, no, we'll put you in a waiting list, no, we're at capacity, all these things that are very negative, you know, and there's no attempt there to build a rapport. You know, if these patients probably aren't going to access care, NHS care, then we're not upselling or heavy selling, we're just having a conversation and telling you what their other option is, you know, and having that, you know, as I said, you know, saying to patients, you know, as you're probably aware, there's a bit of an NHS dental crisis. A lot of patients can't access care. Many NHS patients actually choosing to go on to a dental plan because it gives them the confidence that they're going to be seen and they're going to be looked after, and they can spread the cost of that care over the year. Shall I tell you about it? And it doesn't matter how you say it, but what you're doing is the number of times patients say, actually, you're the first person that's explained that. You know, we're just being honest. They're probably not going to get care. We're not saying they're not going to get it, but they're probably not going to get NHS care. You know, please feel free to ring around. If you struggle, you know, you're very welcome to come back and have a chat with me. We're just being normal people.
Normal, you know, helpful people.
That rapport, that empathy, you know, really, you know, I completely understand, you know, your disappointment, you know, however, 1 in 2 people in the country are not able to access care, and that is something that is causing a problem. You know, we're empathising, we're not going, oh, I'm sorry, you know, it's not our fault.
No.
These greedy dentists, honestly. That's the public perception, isn't it? You know,
well, it used to be, but I think the BDA has done a very good job of turning that around and actually, you know, making people aware of the fact that it's not the dentist's fault. They've got to run a business and they've got to be able to afford to run a business.
The perception, we're going slightly off subject now, but the perception that I've had of patients over the years is patients think that people in NHS practices are paid by the NHS. That they pay a wage to a dental nurse, for example, or a wage to a dentist. The perception, but you're right, BDA are definitely, you know, breaking down those walls. But what we have to think about is the patient's perception. You know, when we say to a patient, no, we can't see you on the NHS, but we can see you privately. What is that saying? You know, that, and it's all comes down to, you know, communication. You know, we are not able to offer you an NHS appointment. However, there is another option. Would you like me to tell you about it? You know, it's just very different. It's the right way to have a conversation instead of, you know, like I say, it's not about being scripted. It's about getting the message across to patients. But more importantly, it's about showing a bit of empathy, because some practices, I have to say, and you know, they've taken it on board, is they're almost using it as a power thing. You know, oh no, we're not able to see you, but we can see you private. And it's done in, I don't think it's intended sometimes, but it comes across as it's a weapon almost. And it's like, let's get rid of that. Let's actually go back and go, this patient has contacted us because they've got a need. So what are we going to do? We're going to tell them what we can do for them. And then it's their choice. So yeah, getting our teams confident with these conversations. It's not their fault that the NHS is going down the spout. You know, it's not their fault that the patients come a day late for their appointment. It's not their fault that the dentist that runs late every single day. You know, there's things, don't absorb it. You know, unless you've made a mistake directly, in which case we go, do you know what?
Really, really sorry. Hold my hands up.
So sorry. No excuses. I'm not going to say, you know, I've had a bad time. You know, just sorry. Yeah, I think we need to be like that with our teams as well. If we have the default that nobody comes into work in the morning decides they're going to, make somebody else miserable or make mistakes,
Quite.
But default that this happens, and we, unless it happens every day, let's be supportive.
Yeah, and deal with it. Well, thank you so much for that, Lisa. That's so informative. I'm sure that people listening will get an awful lot out of that conversation. And I really appreciate you spending the time with us, because I know that you're an extremely busy woman who has an awful lot to do. So thank you so much.
My pleasure. Thanks, Hazel.